How do you think the whole mental health and psychology sort of revolution we've seen over the last 10 years and the TikTokification of mental health has led us astray?
So I think there are some things that are good about it and some things that are problematic. So I think the really good thing about it is that there is a lot more awareness of mental health. So we now realize, so what I used to see about 10 years ago, right, when I was seeing patients is like people would come in and they would not realize that this is a problem that can be fixed. So people would come into my office and they'd say, I'm a loser. Other people are able to get out of bed, they're able to have discipline, they're productive, they're happy, but I'm a loser, I have no willpower, I'm pathetic, I'm not fundamentally broken in some way, but there is some kind of process going on in my brain, in my mind, that is responsible for my problems. And if I fix that, then I can be well. Now, on the flip side, what started to happen is no one on the internet understands the concept of differential diagnosis. So everyone is like, oh, I have a TikTok that if you sometimes forget your keys, you have ADHD. If you are happy in the morning and sad, if you have a kid who throws temper tantrums, they're bipolar. So everyone is taking a symptom and jumping to a diagnosis. Whereas like literally half of what we learn in med school and what we do as doctors is everyone thinks it's about treatment. It's about differential diagnosis. It's about understanding that if you lose your keys, there are all kinds of reasons for that. If you have difficulty getting out of bed, maybe it's depression, maybe it's trauma, maybe it's ADHD, maybe it's anemia, maybe it's obstructive sleep apnea.